right, for our audio visual crew, you're warned. All right, I've got 3 o'clock if everybody's ready to go. It's Wednesday, September 29th, 2021. This is the September meeting of the Champaign-Urbana Mass Transit District Board. At this time, I'll ask for a roll call of the board members.
Barnes, Chaplin, Delgado, Fasella,
Present.
Hannon,
Here.
Nudo, Dial.
Here.
Quorum is present.
Thank you. I'll just remind everyone, silence your cell phones or electronic devices while we're getting started here. Our next item is approval of our agenda for today's meeting. I'll ask for a motion and second after your review.
I move the agenda be approved as distributed.
I'll second that.
It's been moved and seconded to approve our agenda for today's meeting. All in favor?
Aye.
Opposed? That motion carries. Audience participation. Surveying the room. I don't see anybody, so we will move on to the approval of our minutes from our open session board meeting from August 25th, 2021. Those minutes were in your packet if you'd like to review those for a moment.
I would make a motion that we approve the minutes from the packet.
It's been moved and seconded to approve the open session board meeting minutes from August 25th, 2021. All in favor?
Aye.
Opposed? Hearing none, that motion carries. Next item is communications. Carl.
I don't have any communications to share right now. I did receive an email that I'll be forwarding to each of you, and that sender asked me to make sure that you got it. It is an individual who is visually impaired, or who has recently become visually impaired and has started using our services. It was mostly complimentary, but she had a couple of suggestions on how we could put some information out that would help someone who is visually impaired a little more. So I'll share that with you, share it with our tech department and our customer service, and but it was a good positive email.
Okay, thank you. We'll look forward to seeing that. Any communications from any of the other board members that they might have received over the last month? Seeing none, we will move into the managing director's report.
All right.
Go ahead, Bruce.
Somebody has come late. I don't know what we do.
That can be in the audience. That's perfectly fine.
Okay. Thank you. This report is on last month, August statistics. And so ridership is kind of roaring back right now, which is heartening to see. But it has not reached the pre-pandemic levels, but it's giving it a run for its money. So that's nice to see. We had 567,618 trips in August of 21, and that is 113% higher than August of 2020, when we had 266,497 riders. Our 5-year average was 589,497, so we're still about 30,000 rides short of that. But if you look at the chart on page 5 that's further below the normal ridership data, and I think we have this for the screen also, there's a August ridership by year, and that's mostly like the monthly ridership, but the gray bar is for August of 2019, so that's the August pre-pandemic. Instead of the other chart, the gray bar is the 5-year average. So the blue and the orange bar are the same for this year and last year, and but this compares those to pre-pandemic. So I I'm a transit nerd, so I find that interesting. Hopefully, you find it somewhat interesting that we're doing so well compared to last year, and we're actually nipping at the heels of the pre-pandemic numbers. So that's good news. Moving on to the monthly operating revenue, the August 2021 operating revenue was 18.8% above August of 2020, and the year-to-date operating revenue was 12.8% above FY 2021. I'm sure I don't need to tell you that that's because we weren't collecting fares last year. So, but it's good to be collecting fares again and having a community participation in that. Our operating expenses for August were 4.8% above August 2020. Year-to-date operating expenses were 6.9% above FY 2021, and that's mostly due to the normal, annual increases to wages and benefits and that kind of thing. But also, we're just paying a lot of overtime right now because of the employee shortage that we continue to experience. The year-to-date revenues and expenses, our operating revenues were $423,151 below budget, and the operating expenses were $969,464 under budget. And then I don't think I have a chart for this, but one thing I'll just read through on page 7. Again, just kind of interesting to watch the trend line that we've experienced pre-pandemic, in the pandemic, and then I guess technically we're still in a pandemic, but at least we have some semblance of recovery underway. And the weekday ridership in 2019, the average weekday daily ridership was 26,999 per day. Last year, it was 10,292, and then just last month, it was 21,146. So that's only 5,000 and some change short of what our average was in 2019. And then Saturday was very similar. It was almost 15,000 pre-pandemic, 6,000 last year, and just over 14,000 this year. And then our Sunday ridership has actually improved. It went from 7,600 pre-pandemic, 3,700 last year, and 8,400 per day this year. So not exactly clear what's happening on Sundays, but it's nice to see that. Maybe, yeah, it could be. I don't know. I don't know what church attendance was pre-pandemic, but who knows? Maybe the pandemic has put the fear of God in some people. All right. With that, I just final comment that last board meeting we had a little discussion about staff doing a better job of responding to questions that you have during board meetings, and so you all have gotten a update email from me that had a whole section that listed out the questions that you asked last month, and so I've responded to each of those, and if you have any follow-up questions to those answers, we can touch on those. And in addition to that, we can answer any questions through page 38.
Anything for Carl on his report, or any follow-up from anything from last month?
How is family leave monitored? Like specifically the FMLA time, the family our HR department works with all the departments that have employees in them, and so for instance the operations department or maintenance department, if they have an employee who has signed up for FMLA and we've gotten the documentation from that employee's doctor, then they request the FMLA time, and our HR department manages that. I'm not sure if that's exactly what you're asking, but
yeah, sort of. But with private business, especially
Alan, would you turn on your microphone?
I got the wrong, I was pressing the wrong button, I'm sorry. With private business, at times, the corporate doctor gets involved just to evaluate, to see if that's appropriate, you know, vis-a-vis what the family doctor's saying. It just depends if it goes over the limit of what it's called for. So I just bring that up.
Yeah,
See, we've got 12 or so that are beyond.
yeah, we don't have a corporate doctor. We do have a medical review officer that we have under contract, but we really only use that structure for the Substance Abuse, the Drug-Free Workplace Act policy that we have in place. We have doctors that people can go to that we pay for them to go to these doctors to get their DOT card, Department of Transportation card, that all of our drivers need and maintenance individuals need. But we don't have anything that reviews the FMLA requests on top of that individual's doctor. But that doctor has to certify. They have to put their name down and certify that you know, the whatever the issue is eligible for FMLA.
I believe maybe our attorney can back me up if I'm right or wrong. I believe you can also get the leave if you have to care for a person who has.
Sure. Yeah. You know, you're absolutely right. We can ask the attorney to back you up too, but I'll back you up, Margaret. No, that's true. There are several things that you can use FMLA for if you adopt a child, or your wife gives birth to a child, or you give birth to a child, or you have an ongoing medical situation, or a family member that you care for has an ongoing medical condition. So yeah, there's a whole you know, list of things that fall under FMLA, which is a federal act that we have to comply with.
Are the COVID childcare things falling under FMLA if your school's closed, or, you know, your kids are doing school from home because of the COVID?
I mean, yes, it's a little more complicated than that because they've added add-on acts. So there's FMLA, there's FSLA, and so that's the Federal Sick Leave Act. So there are some additional things that they've added on. Interestingly, tomorrow is the last day of eligibility for the COVID-related absences.
Just one last comment about the 12 that are beyond the extension. You know, that contributes to your overtime, obviously, and sometimes, well, our insurance company always told us that having an outside doctor basically validate the cause and the effect and the progress kind of puts it in the person's mind that, you know, it's not forever, and you need to make some progress if there's progress to be made. And so it's a cost of doing business.
Yep.
Additional questions for Carl on his report up to page 38. Seeing none, we'll move on to the MTD Go Smoke and Tobacco Free policy. Carl.
I'm going to ask Amy Snyder, our Chief of Staff, and Josh Dahm, our Illinois Terminal Director, to come up. They're going to give you a presentation. This is something that we've been working on for quite a while and actually put on pause for a good deal of time because of the pandemic. But I will let Amy and Josh go into detail on that.
Thanks, Carl. Hello. Since Josh and I are sitting pretty cozy, I'm going to keep my mask on. But if you can't hear us, please let us know. Next.
Are you using the down arrow?
I was. You can try using the up arrow.
You're moving.
Oh, I swear it didn't work. Off to a good start. Thank you so much, Carl. All right, I swear we're going to get going. MTD goes smoke and tobacco free at all of our facilities and grounds is what Josh and I are here to talk to you about. I'm Amy, and I want to start with a little bit of a history. So in 1975 is when MTD prohibited smoking on our buses. And then we went 20 years and time moved forward. In 1995, in our employee handbook, we made it that employees could only smoke in designated areas when they were in uniform. The handbook also clarified that you could not smoke while you were on the clock. So this has been in place for 25 years. And I'm sure employers recognize that this can be a challenging thing to enforce, but this has been in our handbook since 1995. In 2008, the Illinois Clean Air Act changed everybody's lives when it prohibited smoking indoors and, of course, prohibited smoking 15 feet from entrances. And that's what most of us are complying with today. And so what Josh and I are here to talk about is a proposal that next year, January 1st, MTD would go smoke-free everywhere, which would go beyond those 15 feet. To provide a little bit of context for you, I reached out to the Public Health District to see what other entities in our community are doing. And while I believe MTD is a very innovative organization and we've done a lot of great things, I don't think we're really cutting edge here. As you can see by this list, lots of entities have taken this on for similar reasons that we have here at MTD as well. This is also a journey that the public has been pushing us to take. This is aggregated complaint data in 3 different categories where passengers feel trapped inside a bus shelter. They don't want to access certain services because someone is smoking. And I want to stress that this whole exercise is not to shame people who do choose to smoke. It's about making accessible and equitable spaces where somebody can choose to avoid something that is undeniably toxic. And so Josh will talk a little bit more about how that impacts our passengers here at Illinois Terminal and our visitors. And so I'm just going to quickly touch on some categories here about why we also believe, along with our passengers, that this is a good decision for MTD. I mentioned, a core value for us is to embrace opportunity. This policy is an opportunity for us to partner with our passengers, our customers, our visitors, our tenants, our employees, to really promote an environment that is safe for everybody. Public health is everyone's responsibility. It's certainly MTD's responsibility. And I think if the pandemic showed us anything, it's that we all are responsible for each other. And so we want to promote that environment here at MTD. And, the hazards of smoke, secondhand smoke, like I said, you can't refute those. And it will always remain a personal choice. Next is, of course, equitable environments that make people feel safe are key to what we do. And I think as we move, hopefully, out of this pandemic, we're asking ourselves at MTD, who do we want to be and what kind of spaces do we want to promote? And so this feels a part and a piece to that. We want to empower our customers. So our street supervisors are not going to become the smoking police. We don't have those resources. But if this policy goes through, we will put signage at all of our bus shelters. And this will enable passengers to point to a little sign to ask the person sharing in that space to be respectful. And again, as we rebuild, ridership is down about 20%, but that's really great. And we want to continue to say, how can we make that passenger experience better? And just to be super redundant, making people feel that they are in a space that is not a risk to their health is really key to that. So I'm going to turn it over to Josh to talk about, in particular, Illinois Terminal and the opportunities here with this policy.
Thank you, Amy. So smoking is an ever-present issue and concern at Illinois Terminal. As Champaign-Urbana's multimodal transportation hub, Illinois Terminal provides a range of services for the local community, but also regional and international visitors. We take great pride in Illinois Terminal and our ability to provide a welcoming, comfortable, and safe environment for our guests. But permitting smoking does make that more difficult, as oftentimes guests have to walk through the platform through plumes of smoke just to get to their bus. In addition, litter created by smokers creates a substantial amount of work for staff and increases the negative perception for our visitors. Now, while we do currently monitor and enforce the Illinois Clean Air Act, which prohibits smoking 15 feet from an entrance, that's incredibly difficult to enforce as we have very limited space on our platforms. We do acknowledge that going smoke-free does have the potential to affect our surrounding neighbors, as guests would have to leave the property to smoke. While we can't guarantee smokers will go to one area, we have identified the corner of Bailey Street and Market Street as a reasonable alternative location for the smokers. Smokers would not have to cross any busy intersections, and it would be a short distance from boarding locations, lessening the inconvenience. Next slide. So guests that are unwillingly subjected to smoke may be triggered both physically and psychologically. This could be the result of a current or past battle with addictions, health conditions such as asthma, or associated with a traumatic experience in their past. Illinois Terminal staff have interacted with guests that identify in each of these categories. And again, a major byproduct of smoking is the litter that it creates. Unfortunately, the picture that's on this slide is not an uncommon occurrence. Because Illinois Terminal is closed from 12 a.m. till 5 a.m., we don't have staff that can monitor the platforms. So unfortunately, sometimes folks do tip over our litter containers and our smoking urns and cause a significant amount of mess that our employees have to clean up.
Thanks. So just to be clear, this policy would cover all MTD facilities and grounds. So of course, the entire fence line of Illinois Terminal, the fence lines of our other facilities, and would affect everybody who interacts with our services, from people who are riding Amtrak to our employees to everybody in between. And I do want to note too, we're saying smoke and tobacco free to include all forms of tobacco use, including e-cigarettes, and smoke being cannabis as well. So we brought this presentation to you. We published it in our board packet. We have opened up a 30-day public comment period. Here are some ways to share your thoughts. We want to know how this impacts everybody, the good, the bad, and everything in between. So feel free to use any of those venues. And then our next steps are a public comment period until our next board meeting, which is when we will bring to you the full policy for the board to consider for adoption. If the board does vote for that to go into effect, then we would have about 2 months of soft enforcement in November and December, with January 1st, 2022 being the enforcement date. And that's all we have for you today. If there are any questions or comments, we're happy to take those.
Questions for staff on this item from the board? I have a question. Smoking policy. The policy is smoking and use of tobacco-related products, cannabis, electronic cigarettes, vaporizers. Is that smokeless tobacco also?
You're talking about chew?
Sure.
Yes, it does include smokeless tobacco.
Okay. Because it doesn't say that.
We can make sure to clarify that.
Okay. I'm just wanting to make sure what the intent is. I was confident that's probably what your intent was, but it doesn't say that, so.
Noted.
All right. Any additional questions from the board? All right. We'll look forward to seeing this next month after our comment period. Thank you.
Thank you.
All right. Our next item is service reductions.
So Jay Rank, our operations director, is going to come up for this presentation. And this is a follow-up to a topic that I'm sure is becoming very near and dear to everyone's heart, and that is our employee shortage and how that's affecting us and affecting the community and our riders. And so Jay is going to delve into that, not too deeply, but a little more deeply than what we've talked about before in the past, because we tried what I would like to think was a noble experiment on how to handle this. And when we designed the noble experiment, we didn't count on the Delta variant of the pandemic and some of the other variables that have reared their heads, and so the environment in which we operate has just altered more dramatically than we expected it to. And so Jay's going to talk about the impact of that and what our plan moving forward is. So Jay.
Yeah, thank you. Jay Rank, Operations Director. So yeah, this is not something I want to come talk to you guys about, but we found ourselves in this difficult situation. And like Carl said, we try to plan, and for various reasons it's not working very well, and we need to shift the plan. So a little bit of an introduction. I'm sure you guys remember in March last year, COVID hit locally, and U of I and the school shut down, and we essentially did our non-U of I service from then through December 2020. As the spring semester happened, there was this hybrid version of classes where there were some students in town. So we offered we called it a hybrid service, where it was essentially our non-U of I service plus the Illini route, and the service ended about 1 a.m. opposed to midnight, which is our traditional non-U of I service. And then this summer we had our traditional summer service, where it's just back to normal in terms of our service. So that's really the question came to us, is what to do for the fall. We knew that we were short operators because of the pandemic, our attrition, retirements, and in that situation. We also knew that the U of I and the schools were planning to come back 100%. So we weren't sure exactly how to handle that. Should we try a reduced model like we've done in the past, or should we do the full service, knowing that it's really going to be difficult? So that's what we decided to do, but with a relief valve that we called Jenga runs, and I'll explain that in a minute. But basically it was an opportunity to provide as much service as we can each day, given the number of operators we have available to us. So that's what we've been providing this fall, and it's not working. So we'll talk about what we're going to do next. But we realize how difficult this is for our customers and our service, and this is really the last thing we want to do. But like Carl said, we had this effort, and it's not working out. So here I'm going to go into the weeds a little bit more than I think normally we would at a board meeting. But I want you guys to know kind of what we're talking about and be informed. Okay, so the Jenga approach. The idea here is our Jenga tower is our service, or more accurately, our work board, and each run is a piece of the block. And the idea was that we put out the service, and we'd be able to build the work board in a way that you could pull runs out without dismantling the entire work board, without it all falling apart, okay? So, so the idea is to be at least disruptive and have dynamic service cuts that preserves as much as of the service as we can each day. So you may know that our work board is a combination of straight 8-hour runs for operators, split runs, which is 2 different pieces, or just pieces. And, you know, it's pretty easy to cut an 8-hour straight because there's just one person involved. But if you cut a split and one of the pieces is a Jenga run and one of them needs to continue to operate, well, then we have a problem where we need to shift people around even more. So we built the work board in such a way that we paired the pieces we think were likely to be cut together so that we could pull those out with the least impact. So that's how our work board was built. And we had to be pretty careful about all the runs so that, you know, logistically we could do this, where we're not stranding a bus, or if somebody is out there and the piece before them didn't run and they're ready to work and drive the bus, but no bus is there, right? Having to sort this out took a lot of thought, and we need to be pretty careful about. Even so, I mean, it's a logistical difficulties for our supervisors, our dispatchers, our operators, our maintenance. Requires a lot of flexibility because, you know, we don't find out sometimes about the run changes until the day of. If we get a sick call that day and there's nobody to fill in, we need to handle that on the fly. So we've been moving people around, and that's definitely disruptive. The other part about the Jenga run is that we've identified which runs could potentially be cut and have that ready to be communicated so that our customer service team can put out reroute information basically and let the public know that, okay, today these runs aren't running and these trips and things like that. So we've kind of changed up how our website works too for that reason. Okay. So yeah, the idea is to offer as much consistency among the remaining service that we have and make the cuts as orderly as possible, even though kind of in the background it's really not. Okay, so our workforce. We're about 26 operators short right now. We currently have 194 and 220 are budgeted. So that's a factor that we're trying to work through. But the absences each day are really one of the bigger problems is people are off for FMLA reasons or sick reasons or doctor's excuse, COVID-related childcare, COVID-related household, COVID-related personal. You know, you have no-shows, you have suspensions. So our absence register changes each day, and that's one of the reasons why it's really difficult to plan for the service when we're short on operators. To make up for that, operations, safety, and training staff have driven. We've had planners drive, schedulers drive, street supervisors, trainers, safety and training staff, special services manager, technology services staff, and the assistant operations director, and even I drove a couple school trips. So we're trying to make it work. We're trying to cover everything as best we can, but we're struggling. You know, we've extended people's work days. We've had people come in on their day off. On average, 3.6 operators come in to work their day off. On average, 31 operators are working 10 plus hours a day. So, you know, this is not something that we feel we can maintain long term. And yeah, like Carl said, when we planned to do all of this, you know, nobody knew anything about the Delta variant. So, you know, we knew we were short some operators, but we weren't sure how many operators we'd be off every day on the absence register. So, so next, the service. So I've been keeping track of what we've been doing and what we've been missing since the beginning of our service, our board this year, and we're averaging 141 hours missed each day, each weekday. Sorry, between August 20th and September 24th, which is roughly 11% of our weekday service. Generally, Mondays and Fridays are the worst, largest cuts. Tuesdays is the least. You can see this Monday was the largest amount of cuts we had necessary, and Wednesday the 25th was the least of only 23 hours cut. So associated with this, with the cuts, we found that the teal and the silver evening had some issues with service that we were missing. So we've adjusted our routes to actually add service back into Orchard Downs and Vet Med to help with the cut service. Okay. As far as the impact, I mean, we've been feeling it from every angle. We've had at least 28 public comments on the Jenga runs through our, public feedback. So the public's feeling it. But across all of our organization, the schedulers are working incredibly hard to make everything work. Our supervisors are calling people to fill in runs, shift things around, sometimes at the last minute. Our dispatchers are having to keep up on who's working and what buses are out on the street, what reliefs are happening, and who needs a bus pulled out from the garage. They're using the tools to turn off the real-time information for any runs that we're not doing. Maintenance is having to move buses around because not every bus is pulling out now, and they've got to adjust, because a bus may be blocking another one to get out of the garage. So they're in it. Our information assistants are taking all the calls, and they're taking more and more difficult calls because the customers aren't happy, and they've got to explain why something's happening. Our customer service staff is answering, responding to the complaints. Planning is still making adjustments here and there to make everything as accurate as possible. And then our operators are being moved around like chess pieces, and it's having an effect on their hours worked and where so their morale is hurting right now for sure. And we're just trying to keep it all together. So. Long story short, here we are. We're proposing we cut 23 weekday runs, and these are the runs that we identified at the beginning of the work board as a potential. Basically, our worst case scenario it came true and more, and is really kind of actually more like our average day, as it turns out. We're looking at doing this on Monday. And if we don't do this, I'm afraid we're going to lose more operators because that we're wearing them out and morale's down, and if we lose more, we're losing them faster than we can replace them, and if we're not careful, that will continue. I can say confidently that this last month has felt like 6 months for us, and it's just not sustainable. So our plan is to make these cuts more regular so that we can have some more consistency. At least people know what routes aren't running instead of having to check each day. And to get out of this too, we plan to dedicate 2 more operators to class and road training to increase our safety and training class from 4 or 5 to 7. That way we can get out of this quicker, because that's the answer. We need more people driving buses, and that's the only way. And then we'll update the real time, the schedule, the trip plan information. So we continue, the one-on-one training model is the plan, and that's for quality and safety and training, but having 2 more people involved in that should help us boost, the classes, and hopefully we can get out of this sooner than we otherwise would.
Jay, I think Al's got a question for you.
What's the differential in overtime versus regular pay for a shift,
Time and a half.
dollar-wise?
Sorry?
Dollar-wise,
It depends on their wage scale, like a newer operator.
average.
Sorry?
Average.
You remember when we talked about wages, how we had this long progression, and so we have many steps on the scale. Our average wage is about $28 per hour, and so time and a half.
Okay, so $14 times shift of 8 hours?
No, you only get overtime for the time over 8 hours.
No, I mean, having to pay overtime for a person that misses work, you gotta pay overtime for the other person taking over.
Potentially, if they come in,
Maybe.
if they come in on their day off, and they're over 40 hours already, then yeah, that would be entirely overtime. But if it's a part-timer or somebody that doesn't, have work already, then that would be straight time.
Okay, I wanna get some reference before I bring up, back in 2008, the Champaign County Nursing Home was losing $1.6 million a year, of which $1 million was in the differential of when we had huge absences, 500 a month through the CNAs. The state mandates that you have to have coverage for X amount of people per number of people that are in the nursing homes, you have to have at least this amount. So we had to go to agency nurses, which was 40% more. So we, committee, put together a incentive for people who worked, I assume you pay every 2 weeks?
Yeah.
We incented them, if they didn't miss a shift, we paid them an extra amount. Now, I don't know if that amount is germane today in terms of what we paid them to incent them to not miss work. But we ended up cutting $800,000 out of the agency nurses. And I think you have the opportunity to offer to people, if they make every shift in a 2-week basis, that you incent them, either cash-wise or restaurant credits or whatever, to keep the routes going and see how what happens with that. And it's amazing. I wouldn't have believed, I mean, it was a suggestion that we made that it was going to work, but it worked. And I think you've got an interim ability to offer incentives for people to come to work. Now, being a Republican, I made the suggestion, my side said, you're crazy, you're paying extra people just to come to their job. But it was amazing, the result.
Yeah.
And you were saying 11% of the workforce, you're getting about 11% of the workforce that's calling in. So if you could cut it by 5 to 5% or 6%, you're going to, it's not about the money in this case. I understand that. I got a lesson from Carl on that. But it's about keeping the shift, the number of routes going. And that's really the incentive to be reliable. You start cutting back, and it's a self-fulfilling prophecy of people not, your ridership's going to go down just for lack of not, knowing what the changes are periodically. So I think it's it's something you ought to consider.
Yeah, that's an intriguing idea. It's definitely something to consider. We have, maybe we can talk further about it because we have some complicating factors. We have such a large part-time workforce that doesn't have a set schedule. So how do you define, making all your shifts when their shifts change from day to day?
Set out 2 weeks in advance?
No.
No, how far?
best case, 7 days.
So you mean if you use a 7-day schedule of incenting whatever that 7-day schedule is of making all their shifts? I mean, I reference 2 weeks because
Yeah.
that's what we did at the nursing home, but whatever it is, I think you could come up with an incentive to pay them extra. And what we offer them may not be applicable today in terms of an incentive, but yeah.
You might even be able to differ it for part-time people and say, look, if you pull at least 25 hours, you're eligible for whatever it is. Or, you know what I mean? At least whatever number of hours. I was even thinking, you know, Jay, I don't speak for the whole board here, but obviously you got some license to be creative here because we're kind of hemorrhaging money on overtime. So if it takes, whatever it takes to make people feel good when they pull a 12-hour shift, what's our OSHA limit, or DOT limit on how long their shifts can be driving?
Driving is 12 hours.
Yeah, so if people are pulling 10, 11-hour, 12-hour driving, I mean, you know, buy somebody some lunch or something, make them feel like they're appreciated because they are kind of saving our bacon by doing that. And we don't want burnout.
Yeah, no, and that's the push-pull that we're sort of stuck between. I mean, it's a great idea, and I think we'll try to tease this out a little bit to see what we can do. But you identify the other side of the coin is we kind of don't want everybody just working all the time. Well, not kind of. We definitely don't want people working all the time because they need breaks. And as Jay identified, we have people who are in burnout mode, and that doesn't promote safety, and it's just not good for their family life and that kind of thing. And so it's a delicate line to balance on, but I like the concept. I like the idea, and we'll discuss it.
On an unrelated note, I know we approved that thing for Google Maps last time. Is there any way we can get a rush on that while we're doing something like this? Because obviously we're missing all kinds of schedules that are probably not being updated on Google Maps.
Yeah, I can't speak for Ryan. I think he's back there in the closet, but
I think I can speak for Ryan in saying we have no control over that. Right now, it's in the vendor's lap, and they're on the other side of the country, and some of their programmers are in Germany, and they know that we want the product as soon as possible, and they're working on it, and we can certainly encourage them to work as quickly as possible. But they told us it would take 12 months. Yeah, that's a good point. I don't know if you could hear Jane. She said, actually, technically, we're still waiting for state approval on the contract. So actually, they haven't even started working on it yet because we haven't signed the contract.
yeah, but if we commit to the cuts, then we can update all of our real time, all of our trip plan and everything like that, and it would be much more realistic. So that's the plan.
I mean, I think for that reason alone, we have to do it.
Jay, have you gotten through the completion of
I
your,
have a
why don't you go ahead and finish up your report, and then we
Yeah.
can come back and have some more discussion.
Okay,
Right.
yeah.
I got a question. Have there been any new hires?
Yes, we're hiring every month. We've got classes.
Is that picking up?
Yeah, it is picking up. I think we've got 5 in training right now. I've got a little bit here in the presentation, but yeah, we have issues with graduation, people getting out of training, and then attrition within the first year that we need to try to sort out. But yeah, we with your board approval, we updated the amount of pay we start with. We bumped that up a couple dollars to try to get people in the door. So yeah, we're trying various things, and we continue to hire, and we're ramping up the size of the class, like I said, and we're trying to get.
At this rate, would you be out of the woods by the end of the year?
The end of this year, no.
Pardon?
The end of this year, no.
Yeah. Not at this hiring rate?
No, I don't think so. I would say, we're aiming for, fall of next year when the full U of I service would start again, having.
A whole year from now. What if the hiring rate picks up exponentially, say?
Well, we're limited by our class size is really kind of the bottleneck, because we have an extensive training program, and each trainee needs, we do a one-on-one trainer while they're driving the bus, and it takes people to get trainers out, trainees out of training. So
So class size is your bottleneck. What about having multiple classes?
I think it's bandwidth of our safety training department. I mean, like I said, we're committing 2 more operators to training to get 7 or 8 road trainers. I think 7 road trainers, and yeah, we'll use them as much as we can. So I don't think we have bandwidth to increase the frequency of classes or vehicles. Yeah, we're also limited by at times the number of vehicles available to us because of parts issues in our service as well.
Thank you.
Okay, Ryan, can you put the presentation back up? All right, great, thank you. Okay, so the medium-term timeline is, yeah, we would plan on having this reduction through the spring work board, and then add the Jenga runs back in individually if we have the operators to do so. So sort of opposite of what we're doing now is we've been taking out when we can't fill. Our plan would be to kind of offer a more compact service that we know we can offer, and then if we get more and more people, we can add the service back. So we want to continue to monitor the hours and add service. We want to reduce the number of people on the absence register, absolutely. So if it's incentivizing, yeah, I'd love to do something like that. If it's monitoring FMLA and having a doctor review, that's a possibility. So yeah, I mean, the absence register is the more volatile aspect of it, and then we'll continue to hire as much as we can, and hopefully we get better applicants and better graduation rate and better retention rate within the first year. So we're looking through any opportunity for us to make improvements there. And then the long-term timeline, evaluate the numbers in the spring and summer and adjust or commit to full service in the fall. Like I said, or like Carl said, we didn't know about the Delta variant when we planned for this. What's next for us? We don't know, right? So that's, kind of the loose plan. Analysis, so the training, we talked a little bit about that, but yeah, we need to increase the graduation rate and retention rate of our new operators, but of our current operators that we're risking burning out at the moment too. So we've got a consultant helping us with our training program right now, trying to make it a better experience. We've got adult learners. Are we trying to teach them the right way? We've got a complex service. It's difficult to understand. So, is there something we can do a little bit different? We're looking at that. Yeah, we lose 63% of our operators in the first 12 months. That's a huge number. We spent a lot of time training them, and then for them to walk away. What can we do differently? And we've got exit surveys and interviews starting to happen to find out why people are leaving, why they're not making it. Our safety and training program, our department is doing a cool program with the GoPros. So they're filming our bus routes, so you can watch and learn what the bus route is without having to drive it yourself, maybe on your off time. So if it's familiarity with the service, maybe this will help. And then a little bit of good news. Our employee services department reached out to a bunch of past employees and tried to have them come back. And there's been I would say moderately successful. Just met with a new operator or returning operator today that we're excited about. But yeah, some retirees that left on good terms, or just somebody that left. We reached back out to them. And yeah, we talked about a little bit about, you know, the benefit of the increased wage and the insurance premiums and all that that we offer after 90 days. So trying to kind of talk about why it's great to work here. Okay, and now as far as communication for this, you know, we've got lots of channels to get this information out, and we need to. We've got, you know, press releases, pulse articles on our website, email listservs. We've got accounts on our website where people can sign up for reroute alerts, things like that. So lots of ways to get a hold of people. The Token Transit app has an alert option that we're looking into, so we can put out information to the public. We obviously have social media and passenger kiosk ads that we are going to use. And then, yeah, like I said, we'll work to update all the real-time data, the trip planners and everything like that. So we won't have information about the trips that aren't running. And that's it. So any further questions?
All right. Questions
Brad,
for
could I
thoughts from board?
just,
Yep, go ahead.
Yeah, I just want to jump back to one thing that Jay mentioned a couple of times. He used the term, hopefully we can get better applicants. And I just want to unravel that a little bit, because that in no way is meant to denigrate the newer employees that we have, or even any of the applicants that we've had. What he really means by that, and we have actually been talking about this, we have been losing 63%, as he said, of our trainees. And that's not always because they're not able to get through training, although sometimes that's true for a variety of different reasons. But sometimes it's just they find out, geez, this isn't something I want to do, or they decide they had an opportunity for a different job. You know, I mean, there's a wide variety of reasons. And when we say better applicant, we mean better fit. And somebody who wants to be here, who is able to be here, and will reduce the 63% loss ratio that we have. And so I just want to clarify that wasn't to denigrate any of the employees that certainly have recently come out of training, because they've been great. And even the ones that don't make it, there are sometimes very legitimate reasons why they don't make it. But that just means that at the end of the day, they weren't a good fit. And so we're trying to avoid that.
I think there are many organizations that are in that same boat where they're looking for the right people for the job. So questions or thoughts from the board? Go ahead, Margaret.
Yeah, this is sort of a crazy thought, but would it be feasible in some way to have physically handicapped people or disabled people as drivers? That probably is federal regulations, but I assume the bus could be modified.
Well, making a modification to the bus might not be possible. There might be some really minor things that we could perhaps do. I don't remember a time that we've ever been confronted with that. I will say that we have a very diverse community of employees, and we do have some operators who have, I want to be careful with how I term this, but who have mild disabilities that don't impact their ability to be able to drive a bus. You know, I know this isn't what you're saying, but just as an absurd example, we wouldn't be able to have a visually impaired individual drive a bus. But there are, you know, if you've got a hip problem, as long as you can sit in a seat all day long, but maybe you have problems walking, well, that may be an individual that could drive. So we do have a very, very diverse community of employees, and some of them do have a variety of disabilities.
Well, I was just thinking of the sample of cars. I mean, there are handicapped and disabled people who have cars that are modified so they can drive themselves around.
Yeah, so we wouldn't be able to, I mean, the law is that we have to make reasonable accommodations, and we go further than that at times. That kind of modification would, I think you would argue, most people would argue that's not reasonable, because if I have to make a modification so significant to a vehicle that an individual can drive it, but that's the only vehicle they can drive, then what happens if that vehicle is in the garage for repair? Then they can't operate the vehicle. Or what if we have another one with a similar disability? Now we have two, and so it just gets. We try very hard to have a bus is a bus is a bus. Our maintenance department will tell you. I mean, outside of the 60-foot versus 40-foot, they want to be able to put any 40-foot vehicle on any route that accommodates 40-foot vehicles. They don't want to have to say, only vehicle A can be on this route or be driven by this operator. That would dramatically impinge our ability to provide service.
It was just a wild thought.
Sorry, say that again?
It was just a wild thought.
Not so wild. It's a good idea, and there are some things that perhaps we could do. I'm not aware of being confronted with that.
Additional input from the board. So I just want to make sure I'm clear on some numbers, because I wrote some notes down here, and I just want to make sure. So right now, we're 26 short. And that is a combination of people that don't work for the MTD and people that are on some sort of leave. Is that accurate, or am I wrong?
We are 26 short of our budgeted number for operators. So that doesn't include people who are off for doctor's excuse or FMLA or leave of absence, things like that.
So you're 26 people short.
Yes.
26 is the number of positions that are empty.
Okay.
In addition to that, we
In
have
addition
about
to
30
the-
people
Exactly. Okay.
on a
That's what I was
daily
getting
basis.
at, yes.
Yeah.
So we have a combination of problems. We have these
You bet.
people that we don't even have on the job, and then we have another group of people that aren't coming to work. That 26 isn't that whole group. That's only a part of that group.
Correct.
We have two different bundles of people, and we need to get these 26 people replaced as quickly as we can, which will help make some of this other things that we have going on
Yeah.
less impactful, basically.
Yeah. Well, we want to resolve both sides of it.
Sure.
We want to get as many people that we've already hired back working, and we want to hire the 26 that we're short. Yeah.
Yeah, and the complicating factor with the hiring is, in order to get people trained, it takes a lot of people to do the training, and it takes a lot of time.
Yes.
And at the end of the day, right now, over half of those people that we get trained don't hang around more than 12 months.
Yeah. Or they don't make it out in the first place.
Sure. Okay. So there are a number of complicating factors involved here in this issue. So it's going to take a big solution to fix what is a really big problem and has many facets to it. Is that accurate?
That's very accurate.
Okay. All right. So, anything else you want to, you're putting this in place
Yeah. Monday, October 4th.
on Monday. Okay. Very good. I think that's a better, I really, as much as we hate to do that, I think it's a better solution rather than trying to shuffle stuff every day. I mean, you're probably still going to have to do some shuffling, even if you say this is the line.
Yeah.
There's probably still going to be days when
Yeah.
something happens and you're just not going to be able to fill a hole.
I think that's true. We didn't talk about cutting anything on the weekend. There are times where we've been cutting, and yeah, some Fridays are more than we were proposing we cut. My hope is that if the hours aren't available on the Tuesday and Wednesday, that people open up their availability and work more Mondays, Fridays, Saturdays. But it could be that they're just wore out as well and just need a break. So I'm not sure how much elasticity there is, but yeah, there could still be cuts, and a few cuts I think is more manageable, from an operations perspective. When we get into 24 cuts, that's a lot of movement,
Sure.
and we are, we're struggling with that.
Well, I will speak on behalf of the board that we certainly appreciate that the work that you and all of your staff members and all of the employees have been doing to try to make this as workable as possible. And I know these have created a lot of hardships for all of our employees, not just staff members, but people that are out on the streets every day. So I know the board appreciates the work that everyone's doing. I can tell you from my personal experience, and we talked about this yesterday at a meeting we're in. We have the same issue at the fire department in Champaign. We are unbelievably short of employees. We have a lot of difficulty. People we're not allowed to go home. So if they say you have to stay at work, you have to stay at work. They don't let you go home. So I can appreciate what you're talking about because I've been in that position myself here recently. So we obviously this organization isn't the only organization in town that has that problem, but we're making, you guys are doing a really good job to try to fill the holes, and we appreciate it, and don't let this stress you out too much either, okay?
Yeah.
All right, anything else from the board on this item? Correct. Many organizations have facing this same difficulty, so I can appreciate what they're going through. All right, we will move on now to our action item, which is Resolution 2021-4.
Yeah, so this is going to be Amy, again, doing a presentation on this. She's done the lion's share of the work in concert with our legal department. I do want to just mention as a preamble before she gets into the meat of it, the document that you have in front of you does contain a few errors in it, mostly typographical errors. We are going to correct those, but they don't change the intent or meaning behind the document at all. And if you're curious about what those specifics are, you can talk to Trustee Chaplin, because she pointed out all of them, and which we're very thankful for. I do want to specifically mention one because it could be argued that this does change the meaning of one of the paragraphs. On page 6 of the policy, which is page 61 of your packet, under section C2C, it says under C it says, I'm not even going to read the whole thing, it's a long paragraph, but it talks about a notice will be given if the cost of providing the notice is over $250,000, and then it goes on to say, or that the affected class of subject persons to be notified exceeds $500,000. That we're going to strike the dollar sign out of that, and that's just 500,000 people. If a class of 500,000 or more people are affected, then this notice would be triggered. So I just want to point that out. We'll make that correction on the actual published signed version, and with that, I'm going to hand it over to Amy. Thank you.
Thanks, Carl. Before I get into the meat of this, our finance director pointed out to me in regards to Jay's presentation, I just want to stress that we're not cutting service, we're just cutting frequency. And that's what we've talked in previous months. So I just wanted to get that on the record, just in case. So back to the matter at hand, we're bringing a resolution to you to help MTD be in compliance with two separate statutes, the Personal Information Protection Act and the Identity Protection Act. So this is what we're kind of broadly referring to what will become the district's identity theft prevention policy and program. So this is a lengthy document with lots of numbers and subsets, and so I'm happy to answer any questions you have about how MTD is going to divide this work and do this. If you have any questions about those statutes, we have legal here to answer those. But I will turn it over to you all for questions.
Questions from the board on this item for staff or our attorney? Just basically trying to follow the guidelines, the statutes from the state, correct?
Yes, sir.
Okay. Seeing none, I'll ask for a motion and a second to approve this policy, which is Resolution 2021-4.
I'd make a motion that we approve Resolution 2021-4 as modified by our managing director to fix some scrivener's errors.
It's been moved and seconded to approve Resolution 2021-4 Identity Theft Prevention Program. Roll call, please. Oh, sorry. We can make that a voice vote. That can be a voice vote. All in favor?
Aye.
Opposed? That motion carries. All right, with that, that was our only action item for our meeting today. Our next monthly meeting of the MTD Board of Trustees will be Wednesday, October 22nd at 3 p.m. right here in the Illinois Terminal. At this time,
27th, right? Not the 22nd.
correct. At this time, I will be asking the board to adjourn to a closed session to consider the purchase or lease of real property for use by MTD and to consider the setting of a price for sale or lease of property owned by the MTD, followed immediately by adjournment. I'll ask for a motion and a second on that.
So motioned?
It's been moved and seconded to move to closed session. Roll call.
Chaplin. Yes. Fasella.
Yes.
Hannan.
Yes.
Nudo.
Yes.
Dial.
Yes, that motion carries. We will take a 5-minute break to clear the room, and we will start our closed session.